Here are 16 questions about vaginal dryness that I will answer in today's video. Who is affected by vaginal dryness? Is vaginal dryness on the inside or outside? What does vaginal dryness feel like? Can you have dryness before your period? Or postpartum? Or during menopause? What about hysterectomy? What the heck causes vaginal dryness? Can acne medication lead to vaginal dryness or chemo? Can dryness lead to vaginal atrophy? What should I do for vaginal dryness? Which products can you use for vaginal dryness? What about intimacy and sex when you have vaginal dryness? What about my partnership? Which products should you not use when you have vaginal dryness? All right, let's dive right into a topic that's super important but often not talked about enough: vaginal dryness. Now, I know this might sound a bit uncomfortable or even a little taboo to some, but it's a pretty common issue that a lot of women deal with. Vaginal dryness isn't something that only happens to certain women. It can be a part of any woman's life, whether you're young, old, somewhere in between. Imagine wearing a scratchy sweater that irritates your skin all day. That's kind of what vaginal dryness can feel like, but it's not as easy as changing your outfit. Plus, it's not just about physical comfort. It can mess with your head too, making you feel self-conscious or stressed out, which is the last thing anyone needs. We'll talk about why vaginal dryness happens, how to spot it, and most importantly, what you can do about it. Let's get started and shed some light on this hush-hush topic.
Lights are on.
All right, let's jump into understanding what vaginal dryness really is. Think of it like a garden during a hot summer. Just like a garden needs water to stay lush and vibrant, the vaginal area needs a certain level of moisture to stay healthy and comfortable. And vaginal dryness is like when that garden doesn't get enough water. Things start to feel a bit dry and uncomfortable. Now, this dryness can happen in two main areas, on the outside and inside. When we talk about vaginal dryness on the outside, it's like having dry skin on the surface. You might feel it right around the vaginal opening or on the labia. Those are the external parts. It's a bit like having chapped lips. You feel the dryness every time you move or touch it. Then there's vaginal dryness in the inside, which is a whole different ball game. Imagine a tube coated with a thin layer of moisture. That's what the inside of your vagina is like. When it's dry in there, it's not as noticeable at first glance, but it can be really uncomfortable, especially during intimate moments or even just when you're going about your day. Along with the dryness, many women also experience vaginal itching and dryness. This is like having an itch you can't scratch. This itching, coupled with dryness, can be quite the duo, making you feel irritable and sometimes even leading to discomfort during everyday activities. All right, let's get into how vaginal dryness can pop up at different stages in a woman's life. It's important to know this because, well, it helps to be prepared and understand what's going on with your body. You know how everything feels a bit off before your period starts. That's all about hormonal fluctuations. The levels of estrogen and progesterone in your body are changing, and this can lead to vaginal dryness before your period. After you have a baby, your body is going through a lot of changes, trying to get back to how it was before pregnancy. Plus, if you're breastfeeding, your body is making a lot of the hormone prolactin, which is great for milk production, but not so much for your estrogen. This decrease in estrogen can lead to vaginal dryness postpartum. It's pretty normal, but it can be a bit of a surprise if you're not expecting it. As you get older and approach menopause, your body starts producing less estrogen. This is a big deal for vaginal moisture. Menopausal vaginal dryness is pretty common. 85% of women are affected by it. Your body's natural moisture levels are dialing down because of the lower estrogen. This can start in perimenopause, the stage before menopause, and continue through menopause. If you've had a hysterectomy, especially if your ovaries were removed, your body goes through a big hormonal shift. Even if the ovaries are left in place, the surgery can still affect how your hormones are balanced, which can lead to vaginal dryness. It's part of how your body reacts to the changes from the surgery. In each of these stages, the changes in your body's hormones play a big role in causing vaginal dryness. Okay, so now we're going to talk about some external factors that can contribute to vaginal dryness. It's not just about what's happening inside your body. Sometimes the things we use or encounter in our daily lives play a big role too. When we talk about medications causing vaginal dryness, it's a pretty broad category. You might be surprised how many common meds can have this side effect. Some acne treatments can mess with your hormone levels, which in turn affects vaginal moisture. The same goes for certain types of birth control and some cancer therapies. It's like these medications are doing their job in one area, but accidentally turning down the moisture dial in another. Now, about chemicals, especially those in skincare products that disrupt hormones. These chemicals can be sneaky because they interfere with your body's natural hormonal balance. When these hormone disruptors get into your system, they can lead to a decrease in estrogen, which is super important for maintaining vaginal moisture. So it's not just about the chemicals being harsh, but about how they mess with your hormones, leading to dryness. Lastly, let's talk about vaginal hygiene products like douches and soaps. Using the wrong types of these products can seriously throw off the delicate balance down there. Some douches and soaps have ingredients that are way too harsh for the sensitive vaginal area. They can strip away natural oils and moisture, leaving you dry and uncomfortable. It's like using a really strong soap on your face and then wondering why your skin is all dried out. The key is to choose products that are gentle and designed for the vaginal area, keeping that crucial pH balance in check. So these external factors, medications, hormone-disrupting chemicals, and the wrong kind of vaginal hygiene products are important to keep in mind because they can all contribute to vaginal dryness. And knowing about them is the first step in figuring out how to overcome this issue. All right, let's get into what's really behind vaginal dryness. The hormonal background. This is crucial because more often than not, it's all about the hormones. And understanding this can really help us get to the bottom of why this happens. Estrogen is like the star player for maintaining vaginal moisture. It's super important. Estrogen keeps the vaginal walls healthy, elastic, and well, moist. It's not working alone, though. Other hormones are part of the team, but estrogen is the captain for vaginal well-being. Now, when there's a hormonal imbalance, especially with estrogen taking a dip, things start to change. It's like if the captain of the team isn't playing well, the whole team's performance can drop. When estrogen levels fall, the vaginal walls get thinner and less elastic, and they don't hold on to moisture as well. This leads to dryness. So these hormonal changes are a big part of the vaginal dryness reasons. Understanding that it's often about the hormones, particularly estrogen, can help in figuring out how to tackle this issue. All right, let's talk about the symptoms of vaginal dryness. First off, you might feel a sort of itchy sensation down there. You might also experience discomfort or even slight pain during intimate moments, which is definitely not something to ignore. Some women also notice a burning feeling or even slight spotting after intimacy. For some women, it feels like they have a urinary tract infection, UTI. Now, it's important to know the difference between a little bit of dryness now and then and symptoms that are more concerning. A bit of dryness every so often can be like a random dry patch on your skin, not ideal, but not super alarming. However, if you're finding that the dryness is constant or if it's causing you real discomfort or pain, that's like an ongoing skin issue. This is when it crosses into the territory of symptoms of concern. So when we talk about vaginal dryness symptoms and causes, it's all about paying attention to your body and noticing what feels normal for you and what doesn't. Okay, let's dive into a topic that's super important, but maybe not as well known. Vaginal atrophy. This is closely linked to vaginal dryness, and understanding this relationship can really help in managing both. Vaginal atrophy is like when a lush, healthy plant starts to wither. It's a condition where the vaginal walls get thinner, less elastic, and more fragile. This often happens due to a decrease in estrogen, which is super important for keeping vaginal tissues healthy. Just like a plant needs water to stay plump and vibrant, the vagina needs estrogen to stay healthy and resilient. Now, how does this link up with vaginal dryness? Well, vaginal dryness is often one of the first signs of vaginal atrophy. It's like the early warning sign that the vaginal tissues are starting to change. Without enough moisture, the tissues can become more susceptible to irritation and damage, leading to atrophy. It's a bit like how dry skin can get cracked and sore. Similar things can happen with the vaginal tissues. So when we talk about treating vaginal dryness and atrophy, it's all about getting to the root of the issue. Often that's a lack of estrogen. There are also ways to provide natural protection against vaginal dryness and atrophy. This can include using certain moisturizers or lubricants that are designed to be gentle and supportive of vaginal health. It's like giving that withering plant not just water, but also the right nutrients it needs to get back to its healthy state. Remember, if you think you might be experiencing symptoms of vaginal atrophy or ongoing dryness, it's really important to talk to a healthcare professional. They can help you figure out the best way to treat vaginal dryness and atrophy tailored to your specific needs. Let's chat about the impact of vaginal dryness. The impact of vaginal dryness is wide-ranging. It touches on physical health, mental health, and relationships. It's important to understand these impacts because it helps in realizing that vaginal dryness isn't just a minor nuisance. It's something that deserves attention and care. First up, there are the health complications. Vaginal dryness isn't just about discomfort. It can lead to more serious stuff. You might be more susceptible to infections because the natural barrier, the moisture that helps protect against these infections is reduced. Then there's the discomfort part, which can make everyday activities a bit of a challenge. Dealing with vaginal dryness can really mess with your self-esteem and body image. Thoughts like, do I have to live with this for the rest of my life, can come up. Women might feel less confident or even start avoiding intimacy because they're worried about the discomfort or pain. Speaking of intimacy, vaginal dryness can have a significant impact on your sexual life. It can lead to painful intercourse, which is obviously not something anyone wants. It takes away the enjoyment. This can strain partnerships as it can affect both emotional closeness and physical intimacy. All right, let's dive into some of the remedies and treatments for vaginal dryness. First, let's talk lifestyle changes. Simple tweaks in your diet, staying well hydrated, and managing stress can be big players in how to overcome vaginal dryness. Eating a balanced diet rich in fruits, vegetables, and healthy fats can support your body's natural lubrication. And let's not forget hydration. Next up are topical moisturizers. These should be water-free, chemical-free, pH-optimized moisturizers. They're like special lotions for your vaginal area that help restore moisture and balance. Think of them as a direct fix for the dryness, kind of like applying a soothing balm to chapped lips. The pH level of your vaginal area is super important. It's a delicate balance that needs to be maintained. When you use pH-optimized moisturizers, you're matching the natural pH of your vagina. This helps maintain a healthy environment, preventing irritation and discomfort that can occur if the pH is thrown off. It's important to use water-free moisturizers because they provide better moisture. Unlike water-based products that can evaporate, water-free products stick around longer, maintaining moisture more effectively. It's like using a heavy-duty moisturizer on your skin in winter as opposed to a light lotion. Plus, only water-free moisturizers can be chemical-free. Choosing chemical-free products is crucial because many common chemicals found in skincare and hygiene products can act as hormone disruptors. These disruptors can mess with your body's natural hormonal balance, which is vital for maintaining vaginal health. It's similar to how an unwanted ingredient in a recipe can throw off the entire dish. By avoiding these chemicals, you help protect your hormone system from unnecessary interference, which is especially important when dealing with hormonal-related vaginal dryness. The skin microbiome, which includes the delicate area of the vagina, is an ecosystem of good bacteria that protects and maintains skin health. Using products with harsh chemicals can disrupt this microbiome, leading to imbalance and vulnerability. It's like using a harsh pesticide in a garden, which can kill off not just the pests, but also the beneficial organisms. By opting for chemical-free products, you're choosing to support and preserve the natural protective barrier of the skin microbiome. Choosing chemical-free products, therefore, becomes a twofold strategy, protecting your hormonal balance and preserving the health of your skin microbiome, both of which are crucial in managing and treating vaginal dryness effectively. Or HRT can be a game changer for some women, especially those dealing with menopausal vaginal dryness. It's like replenishing the body with the hormones it's missing, which can help in bringing back the natural moisture. However, it's important to weigh the benefits and considerations. Remember, when it comes to vaginal dryness treatments, what works for one person might not work for another. It's all about finding the right combination that works for you. Whether it's making lifestyle changes, trying topical solutions, exploring HRT, or testing out natural remedies like sea buckthorn or maca root, there are ways to manage and improve vaginal dryness. Vaginal dryness, whether it's on the outside or inside, is a common issue that many women face at some point in their lives. Not often talked about, but pretty widespread. This dryness can show up in various forms like itching, discomfort, or even pain, and it can happen at different life stages, before your period, postpartum, or during menopause. Understanding that vaginal dryness can affect you both physically and emotionally is key. It's not just about the physical symptoms like vaginal dryness and itching, but also how it makes you feel and how it can impact your daily life. Menopausal vaginal dryness, for instance, can be particularly challenging due to the hormonal changes that come with aging. Home remedies might provide some relief, but it's important to know when to seek professional advice. Each woman's experience with vaginal dryness is unique, so what works for one person might not work for another. So here's my encouragement to you. Be proactive about managing vaginal dryness. Please like and share the video with friends who could benefit from it, and subscribe to my channel. See you soon.